There is a shortage in Canada of two key drugs used to treat cancer. The supply is dwindling for two drugs used to treat thyroid cancer and pediatric leukemia. The drugs are called thyrotropin alpha and asparaginase. For more on this, we're joined by Dr. Tom McFarland, who is a clinical lecturer on oncology at the University of Waterloo in the School of Pharmacy. Good morning to you, Doctor.
Good morning. Thanks for having me on, Lindsey.
So why is there a shortage of these drugs?
Well, so in these particular drugs cases, there are a couple of things that play here. There is issues with manufacturing and quality control, particularly with the asparaginase, which is actually pretty difficult to make. And actually, both of these drugs have been short for several periods over the last probably decade or so.
I want to ask you, when we say shortage, I'm thinking about somebody at home and wondering, what does that really mean for a person? Does that, like, how low is the supply right now? Do we know?
Yeah, so the supply is low enough that we may not be able to handle the demand from all patients. So the recommendation from provincial bodies such as Cancer Care Ontario has been to conserve the drug as much as possible. Now, there are mitigating measures that have been taken to try to help with this. For example, with the asparaginase, what's going to happen is we're hoping to get a supply of the drug in from another manufacturer in the United States. That has to be approved by Health Canada, but that may help overcome the shortfall. But really, when you have a situation like this, the options you have are, one, you either delay therapy for treatment for patients, which is not ideal. Mm-hmm. Two is omit the drug from a cocktail of chemotherapy agents that the patient is on, also not ideal and may impact outcomes. Or you switch to something else, which there may be an alternative available and there may not.
How long could this shortage last?
They're actually telling us with these particular drugs, it's probably going to last at least until the fall. And we're getting periodic updates from the manufacturers on, what's happening. What we are seeing with these is we'll see small allocations of it being released. So there is still drug being made, but what is happening is that the companies aren't able to meet the demand that is out there for these drugs at the current time.
Is this a long-term problem?
Overall, if you look at it in a sort of an overarching way, yes. We have seen these types of things happen quite a lot over the last few years. Even prior to the pandemic, we were seeing some shortages. And what's a little bit alarming about it is it seems to be getting worse. We're starting to see more and more of these shortages come into play. Some of that is because of, again, sort of supply chain disruptions from the pandemic, as well as increased demand for these agents with an aging population, for example.
Is there no way to sort of predict shortages in terms of being a little bit more proactive about everything?
I wish there were. Not really. We kind of end up finding these things out from the company through letters that they'll send us, and there's not really any way to predict. Basically, the best thing that we can do in the healthcare system, at least in Canada, is try to be collaborative. Our hospitals kind of work with other hospitals to try to conserve supply, move supply around, make sure that it's used as efficiently as possible. But really, we have to be prepared for these things to be a problem for some time to come.
I mean, doctor, it just feels like we've been doing this story with different medications over the last, 3 years now. We do appreciate you coming on and talking about it, though. Thank you.
Thank you so much.
All right,
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.